Hello, friends. Good evening. I see many chats, but the thing is, I'm unable to read your chats. I don't know why that is happening. I can see 19 messages. But hi, Samrat. I just found one chat now, but others are like, I'm unable to see. Hi, good evening. Little by little, I can see now. Maybe some problem with my mobile because I'm seeing your chats. I'm trying to read your chats through mobile. Okay, shall we start, guys? I'm given only half an hour to 40 minutes for discussing this very, very important topic. So you just can stay for another 30 to 40 minutes. Within that time, we will completely discuss one very important topic, which is a deadly disease, Nipah. Okay. So guys, as you all know, are you able to see now? Are you seeing now? Are you seeing the slide? Yeah, Moon Pie. Yes, because here I'm unable to see the slides. If you have any problem, please let me know. Okay, so welcome to the session Clinical Thursday by DocTutorials. So today, like I said, the topic is very, very important, which is a disease, deadly disease that we are having currently as an outbreak in southern part of India, which is Kerala. And I think all of you know that currently at present, Kerala is facing an outbreak of Nipah. And me, by being one of the person who is directly involved in this outbreak investigation and containment, I thought I will discuss this topic in front of you. So let me start with a clinical scenario. It's not just a scenario. This is what has happened few weeks back. Okay, so this is a question. This is not a made-up question. This is something which really happened 2 to 3 weeks back. Okay, a 9-year-old boy. Okay, this is what has really happened. A 9-year-old boy got admitted in a hospital with fever, difficulty in breathing, altered sensorium, and repeated seizures. His 23-year-old uncle was also admitted in the same hospital with fever and breathlessness. While taking history, the doctor found that the boy's father had succumbed to similar illness 10 days back. Another person who has shared the same hospital with this boy's father who had died. Okay, he also has died due to some unknown infection. The treating physician and the health system promptly suspected an outbreak of a deadly disease known as Nipah viral infection. Okay, so I'm hearing, here it's written no. Is that encephalitis? Okay. Okay. First question is, so I have few questions. You can expect this. See, we will be discussing a lot of points which are important for your PG entrance, as well as if you are an undergraduate who is listening to this, let me tell you, I lost connection once again. Wait. Sorry. What I was trying to say is, if you are an undergraduate, guys, wait. My YouTube session, I'm unable to see you guys. Okay. It's back. Okay. So for an undergraduate, I have some sub questions for your exam. This is how you will be getting a clinical question. You will be given a scenario and you have some sub questions. You know that, right? This is how you get an essay, structured essay question. Okay. So here the question is, what are the features suggestive of Nipah outbreak? Then Mention the epidemiology of this disease. Third question, how will you confirm this disease? Fourth question, how will you manage and control this outbreak? And when do you declare the area free of Nipah outbreak? Okay, hi Pandey, hi Samrat. Yeah, even for FMG, this is important. Nipah is important for every exam. So the first question, let's start with the first question. What are the features suggestive of Nipah outbreak? Or why did this doctor suspected Nipah? So as a doctor, when you see a patient or a case in the hospital, the first thing that gives you some idea about the disease is the clinical features, right? And here the clinical features are very much suggestive of Nipah. Now, Nipah virus is mainly affecting two systems in the body. Which are they? One is respiratory system and the other is your brain. Okay, so if you go through these symptoms, you will find that the patient had fever. That is suggestive of some infection. Difficulty in breathing, altered sensorium, and repeated seizures. That means, yeah, like you have rightly said, Moonpai, it is encephalitis. The child is presented with encephalitis, right? So that is not the only thing that is suggestive of Nipah. See, 2 deaths had occurred within a span of 10 days. Which other disease could be so deadly like this with an incubation period or with a difference of 10 days? And another thing is, see, there is an epidemiological link. Epidemiological link means the 2 deaths that had happened with similar signs and symptoms, they had shared one single hospital. That means this is a disease which is very much transmissible. And if you come in contact, you are likely to get this disease, and the person who gets this disease is likely to die of the disease. Okay, so 2 deaths having similar signs and symptoms, and they were epidemiologically linked. That means they were sharing the same hospital. Okay, another thing is the boy and his uncle. They were the close contacts of the first person who died of similar disease, Nipah. Okay, so that means you will see that there is a clustering of similar signs and symptoms, which is suggestive of a deadly viral infection, which is nothing but Nipah. That is why they have suspected an outbreak of this deadly disease, because there are 2-3 cases having similar signs and symptoms admitted in the hospital. Okay, so let's see little more about Nipah. And I hope you guys know that Nipah has returned to Kerala. In Kerala, we had an outbreak in 2018. Then after that, there was one in 2021. And in 2023, Kerala has faced Nipah once again, which killed 2 people. Okay. And you might have seen this picture, how they were buried with all the PPE kit and, wearing all those PPE kit. So let's see the important points from Nipah viral infection. First, it is a zoonotic disease. Don't you know that? It is a zoonotic disease, mainly transmitted by bats. Not only bats, it can affect any animal. Okay, mainly the domestic animal like pig, dogs. Don't think that only pigs can get affected. It can even affect dogs, cats, horses, goats, and sheep. Are you knowing it? You might be thinking that only bats, pigs. No, even dogs, cats, horses, goats, and sheep can also get affected with Nipah, but it's not that common. The commonly seen ones are bats and then pigs. Okay. Now, little bit about the epidemiology, how it started. The very first outbreak started in 1998-99 in Malaysia and Singapore. And the name Nipah, I have a question for you. How did the name Nipah, that name has evolved? The name Nipah was derived from the name of a village in Malaysia where the first case or first we have identified the Nipah virus from a dead patient. Okay, so that is the name of the village in Malaysia. And the outbreak is mainly affecting respiratory system and encephalitis. And when it happened in Malaysia, it was first affecting the pig farmers. And in India, the first outbreaks were in 2001 in Siliguri. Okay. And as you know, this is the shape of Nipah virus. And like someone correctly said, it is a paramyxo virus. Okay, so this you can expect as an MCQ. And see, the name is Nipah virus is from the village in Malaysia. That also you have to remember as a point. And this is a paramyxo virus. That also you have to remember. Now, coming to the natural reservoir. What you see here is the natural reservoir. That is bat. Now the question is, what is the name of this bat? Is it a insect-eating bat, or is it a, is it a fruit bat? What do you think? It's a fruit bat. This is a fruit bat. Is it a small bat or a big bat? You can see here, it's a big bat. It's a big bat known as Pteropus fruit bat. Okay, it's a Pteropus fruit bat. It is also known as flying fox. It is also known as flying fox. Look at the face. It looks like that of a fox. And so huge. It's not a small bat. It's a big bat known as flying fox. Yes, Stefan, it's a fruit bat. It's a fruit bat. You might be thinking that those which feed on fruit are, very innocent bats. They are less harmful. It's not like that. They are very, very harmful. Now, how are we getting the disease? Infected bats, they shed virus in their excretion and secretion, such as saliva, urine, semen, excreta, and such. So when they bite the fruit, and the food will be contaminated with their saliva and secretions, and the half-bitten fruits, they fall down, and man come and pick the fruit and he eat it without washing. Not just man, sometimes the animals, especially the pig, when they eat the half-bitten fruit, they get infected with the virus, and they act as an amplifier host. The virus will be, it will multiply inside the body of the pig, and pig will not usually will not die of Nipah. Instead, they will be transmitting disease to other people. That means humans. That is why pig farmers in Malaysia, they had died of the disease. And bats and pigs. Bats are usually symptomless carriers. Pig is the intermediate host, and it is also the amplifying host. It is also the amplifying host. That also you have to remember as a point. It's an amplifying host. It's an intermediate host and an amplifying host. Now let's see who all are getting risk for exposure. Like I said, bat-eaten fruits which have fallen down, especially mangoes. Okay, mangoes, jackfruit, guava. They are very favorite fruits of bats. Then consumption of raw date palm sap, which has come in contact with the bats. These bats, they very much like sap of date palm. So if you are taking it raw and eating, you are likely to get Nipah. Then exposure to other Nipah virus infected individual, like the second person who died of disease in Kerala this year, I would say this month, had got the disease from the first person who had died of Nipah. Then close contact with Nipah virus infected pig, like pig farmers had got it earlier. Okay, so these are the risks. Now the MCQ is regarding, or I would say the points that you have to remember is incubation period, 4 to 21 days. So if you have a person who has got contact with the disease person, then you have to wait for the longest incubation period, that is 21 days, to see whether he or she is developing disease or not. That is why you keep them under quarantine. You are restricting their movement for 21 days because you want to see, you have to wait for the longest incubation period to see whether this person is showing signs and symptoms. And the median incubation period is 7. Median incubation period means time taken for 50% of cases to develop disease is 7 days. So on an average of 7 days, 50% of cases are showing signs and symptoms. But it can go up to a maximum of 21 days. I hope it's clear. Maximum incubation period is 21 days, but median, that means Average incubation period is 7 days. And seasonality, it is usually seen from December to May. But this time we had it in September, but usual time is from December to May. And this is a picture. This is an image-based question which came earlier. Which disease is being shown in this cycle? So if you see bat, if you see pig, if you see half-bitten fruits falling down, you don't have to think twice. It is Nipah only. Now let's see what are the clinical features for Nipah. Like I said, Nipah is mainly affecting two systems. One is respiratory system and your brain. So naturally, the signs and symptoms will be like that. So it is affecting the respiratory system. So it starts with, fever, cough, sore throat, little bit of pharyngitis. We have seen patients, okay, when you're keeping them under quarantine and when you are closely monitoring them, you will see how they just starting. They will start with fever, then sore throat, cough, pharyngitis. After some time, they'll have headache, then little bit of dizziness, mental confusion because it is affecting brain. And when it seriously affect the lung, the patient will start developing breathlessness, respiratory distress, then pneumonia. Those two patients who have died of Nipah this month in Kerala, all of them had respiratory distress. They have died of ARDS. Okay. And then they will also show symptoms of encephalitis, brainstem dysfunction, seizures, meningitis, all those things. So just understand that it is mainly affecting the respiratory system and the brain. And case fatality rate. It ranges from, on an average, it ranges from 40 to 75%. Though we say like that, it is different for different outbreaks. What we had in Kerala in 2018, the case fatality rate means out of those who are getting the disease, what percentage are dying. Okay. So what we had in 2018, it was almost 85 to 90%. And there are outbreaks where it had gone up to a level of 100% mortality. That means all who got the disease had died of Nipah. Okay. So on an average, it is 40 to 75. Okay. So those are the points that you have to keep in your mind for the exam regarding Nipah. So we have done with the epidemiology. Second question is also over. Next is, how will you confirm? How will you confirm? Confirmation is very, very important. More than that, early identification and diagnosis is of prime importance in Nipah infection because it's a highly deadly disease, highly transmissible disease. Okay, so it is very, very important to identify it at the earliest. And it is a clinical challenge because you won't, there are so many other diseases which can also present like Nipah, right? All kind of, acute encephalitis syndrome can present like Nipah. So you won't be able to, pick it at the earliest sometimes. So, but it's a clinical challenge to diagnose it early, and you have to ensure all the safety measures and infection control practices to prevent human-to-human transmission. Don't you feel that it's not just treating the patient that is important, but when it comes to Nipah, you should also see that another person will not get disease from this infected person. So infection control practices and all other safety measures, not just the patient, even the doctor. Don't you know that in 2018, one staff nurse who took care of the patient had died of Nipah? So, and even in Siliguri, that means long back in Siliguri, doctors had died of Nipah who were catering to these patients. So you have to be very, very careful. Infection control practices and safety measures are of prime importance. And another exam question which came in NEET INI was, Nipah virus is classified as which biosafety level? It is biosafety level 4 pathogen. Very, very important. That is why you cannot do Nipah diagnosis or confirmation in most of the hospitals. You have to send it to Pune or to some other hi-fi center where some Apex lab, where biosafety level pathogens can be diagnosed. Okay. So the question is, what are the specimens that you require? What are the specimens that you need? Naturally, it's affecting Always remember, it's affecting respiratory system and brain. So you need throat swab, which should be taken in a VTM, viral transport medium. Then 10 ml urine in a universal sterile container. Then 5 ml of blood in a vacutainer and CSF from the brain in a sterile container. So these are the samples, recommended samples for identifying Nipah virus. Okay, so this also you can remember as an MCQ. Though I say MCQ, those who are undergraduates who are preparing for the exam, let it be your third year or final year, doesn't matter, you can expect a question from Nipah. And even if you are a second year student, this is important for your microbiology exam, right? So every apart from first year, in all the other years, you have to know about Nipah. Okay. Then, are you guys there? Are you guys there? I'm not seeing any chat. Okay. Then, what are the investigations? So these are the samples. Which are the samples that you require? Next question. Which all investigation you do? Mainly two investigation. One is real-time RT-PCR to find out viral RNA. Okay. Then antibody. That means IgM and IgG antibody. IgM is suggestive of recent and IgG of previous. Okay, Stephen, thank you. So you have to find out antibody. So RT-PCR to find out the viral RNA and antibody. You have to find out. Okay, so these are the two tests that you do. Now, what is the next question? So we have done with the first one, second one, third one. Next is fourth one. How will you manage and control this outbreak? How will you manage and control this outbreak? See, whenever you hear about a disease, mostly you will be concentrating on the patient alone. But when it comes to Nipah, it's not just the patient that you should be worried of, but their contacts as well, right? Because I've said that in Nipah, this is a deadly disease. Those who come in close contact with the patient are likely to get the disease, and there is no treatment as such for the disease. Okay, so you should be really worried about those who have come in contact with the patients as well. So what I want to tell you is you have to manage patient as well as you have to manage their contacts. And you should also see that no other patient will, or no other person, I would say, whether it is a doctor or a patient or a visitor, no other person would get disease from this patient. Okay, so the safety precaution, the isolation facility, all those things should be strictly followed. Okay, so like I said, Nipah has a high potential of transmission from human to humans with high potential of transmission, high mortality. Along with that, no definite treatment or vaccine so far identified. See the status of the disease. Okay, we don't have any definite. Of course, we are giving treatment. I'll come to it, but you can't say this is the drug for this particular disease because we are not very sure whether it will work or not. But now we are seeing that few drugs are working. We'll talk about it after this. Okay. Hence the management. So whenever you're getting a question about how will you manage this, it involves infection control practices, then triaging the patient correctly, isolating, and then managing the patient, including intensive support care, because this disease can worsen the condition of the patient, right? So once a patient gets hospitalized, within a span of 24 hours, the patient will be taken to ICU. Okay, so you should be having a very good ICU facility. Okay, Samrat. Love. Your name is Love? Or Love? Okay, sorry. I Love Pandey. I read it as LOVE. Okay, so What do you mean by triaging the patient? Triaging the patient means if a patient with fever is coming to your hospital, whenever there is an outbreak, and if a patient with fever is coming to your hospital, you have to suspect Nipah, especially if it is a person who is coming from an area where Nipah has been reported. So what you have to do first is, if you see that this is a high-risk patient, or that means a patient with fever or some signs and symptoms suggestive of Nipah coming from an area where Nipah has been detected, or if this person is someone who has already come in contact with the patient, then you have to be very careful. You have to triage that patient, make sure that he will never ever come in contact with any other person in the hospital. So just take him to an isolation facility. Okay, and you have to keep that patient, and rest of the management should be followed in that isolation facility. And the isolation facility should be a place where there should be one patient should be given one complete room. Are you understanding? He should never come in contact with anybody else, right? A complete room with a washroom. Okay, that washroom should only be for that patient, because body secretions, if that comes in contact with another person, that person is likely to get the disease. So you have to make sure that he's completely alone. All the facilities, including the washroom, should be given separately. So a bath attached room is what we are giving for isolating Nipah patients. Okay, and treatment. Treatment is mainly supportive. I would say we have treatment now, but it's mainly supportive, including standard care for ARDS, myocarditis. Okay, thank you. Thanks for that compliment, Mobile. Okay, so standard care of ARDS, myocarditis, encephalitis. The standard care, someone is developing ARDS or myocarditis or encephalitis, we have a standard protocol in the hospital. So that should be strictly followed. And care should be individualized according to the clinical presentation and management decision according to the institutional medical board. This is very important. Most of the hospitals are following CDC guideline and WHO guideline. And in my hospital, we are following WHO guideline. Okay. Now coming to the medicines. This is very important. We have mainly four medicines for Nipah. Four medicines for Nipah. Okay. And two are starting with R. One is ribavirin. Sorry. Yeah, I know. Love Kush. I know. I read it wrong as LOVE. That's why. Then later I felt that something is, I felt that I had read it wrong. Okay. Love. Okay. Okay. So ribavirin and remdesivir. Okay. Remdesivir is actually, this was a drug we had for COVID. When the COVID viral disease was there everywhere as a pandemic, we have tried remdesivir. But now we are giving it for Nipah, and we are seeing it is working a little bit, because the case, that boy that I had mentioned, then his uncle, they have all recovered. So we have so far we have only 2 deaths because of Nipah, and these two cases were actually undetected. But after we have diagnosed Nipah, we could treat all the other patients with remdesivir, and hopefully it is working. Okay, and the other drugs are monoclonal antibody M102.4. It's actually from foreign country, from Australia. We have actually taken this medicine. Then favipiravir. Okay, so these are the drugs that we are using for Nipah. But what you have to keep in your mind are 2 important drugs. One is, sorry, this one. One is this one, and the other is this one. Both starting with R. Okay. two important drugs that you have to keep in your minds. Now, when will you discharge the patient? So you have given the medicines to the patient, then you are going to discharge the patient. So you feel that, okay, the patient is recovering. Now, how will you confirm whether it is time to discharge the patient? It's a very, very serious disease, right? So you have to make sure that the patient is completely free of the disease, because his body, his body fluids can give disease to another person, right? So first, he should be clinically stable. He has come with a serious disease. He had encephalitis. He had repeated seizures. Now, once he is stable, it is a sign that, okay, it's time to discharge the patient. Next, RT-PCR from all the three samples, that means throat swab, urine, and blood, are negative on 2 occasions at least 5 days apart. Okay, patient should be clinically stable. Then you have to do RT-PCR from all 3 samples, that means throat swab, urine, and blood, on 2 different occasions, 5 days apart. If all these 3 are showing negative, then you can make sure that, okay, now the patient doesn't have virus in the body at all. He's clinically stable. You can very well discharge the patient. Okay. After that, keep the patient under follow-up. The discharged patient should remain in isolation at their residence for 21 days after the discharge. Even after the discharge, you tell the patient to stay at home for 21 days. And he is advised to follow up on 28 days, 56 days, and 90 days for discharge, after the discharge. You know why? Because patients with confirmed Nipah infection, there are reports that relapse and late onset encephalitis are not very common, but it can happen. That is why you are keeping them under long-term follow-up up to 90 days. Okay. Are you with me? So decide whether it is time to discharge the patient. After discharge, don't think that as a doctor, my duty is over. You have to keep them under follow-up up to 90 days to see that they are free of any signs and symptoms. They are not getting any relapse. Are you with me? Now coming to how will you manage the contacts? Haven't I told you it's not just the patient, but you should also be worried about the contacts, because their contacts can get disease in future. So what will you do? There we do a field investigation. What I am showing here is the field investigation that was done by Department of Community Medicine when we had this Nipah outbreak. Okay, so what you see here are the pictures of the team in community medicine who had gone to field. So I think you can make out me. I'm also there. This is me. This is also me. So you can see. So what I'm trying to tell you is this is what we do in community medicine when we are getting an outbreak. So you go to the field. Field means you have to visit the houses of people who had died of Nipah. You have to visit that area from where the Nipah was reported. Okay. And there, what is the purpose? Your purpose is to see how many cases are there, and you have to see how the disease is happening, what are the risk factors that has led to this disease. And if you know the risk factors, you should be able to control the risk factors, and you have to stop the outbreak. And you should also see that the disease will never ever happen in future. Okay, so what you do is, we go to the field, then you have to search for further cases. You have to see whether any other patient with similar signs and symptoms are there. Then you have to pick them at the earliest. And if you see any patients, then you have to prepare their route map. Route map means where all they have gone during the period of infectivity. If they had gone to if they had attended a friend's house, if they had gone to a bank or somewhere, then you have to see with who all they have come in contact, because all those who have come in contact with this patient might get the disease, right? So you have to prepare a route map. Then you see what is the source of infection, from where they got the disease. Okay, is it from a patient who already got Nipah, or is it from some other source like, bat or eating by some fruits? All these are very important. Okay. Then what is the mode of transmission? Then you have to trace the contacts, who all are their contacts. And when it comes to, the case finding, there we have two types of case, which I would like to tell you. One is, this is a commonly asked exam question. You have, when it comes to cases, I think green is not that visible. I change it to blue. Okay. You have primary case. Guys, you have to answer this. Is it time? Okay. I have 5 more minutes left. You have primary case and index case. Now, what is primary case? Should I wait for your answer? Are you guys there? Primary case and index case. I think there is a lag. I think there is a big lag. So I'm not waiting. Primary case means it is the first case. It is the very first case of a disease that has happened. Now, what is the problem with the very first case? The very first case may sometimes go unnoticed, right? You wouldn't even realize that a case of Nipah has happened. It's not only with Nipah, this happens with every outbreak. Okay. Sometimes it may, you will, or the health system will miss the case. Whereas index case is the very first case which came to the notice of the health system, which was noticed by the health system. That is index case. Okay. Is it clear? So, in our scenario, that means in the scenario that has happened in Kerala in September 2023, the primary case was the patient who, that means the father of the boy who had died of Nipah. So we couldn't confirm that Nipah at that point, but because he died 10 days back. But he had similar signs and symptoms, which somehow we couldn't confirm earlier. Okay. Whereas the first system which came to the notice of everyone was the second patient who had died of Nipah. So we took his blood, we took his CSF, we took his throat swab, and we did Nipah confirmation. And he is the first person who was notified by the health system as the case of Nipah. Okay. So what I want to tell you is primary case is the first case which was introduced into a virgin community, whereas index case is the first case which was noticed, which was seen by the health system. See, there is no need to mug up. Look at this. What you see here is the index finger, right? You use index finger to show something, right? So that people can see, right? Are you understanding? So index case is the very first case which was shown to people or health system so that it was noticed by everyone. Is it clear? So primary means first. Meaning is first, right? Index means shown. Okay. Though you feel it's very simple, please do understand it is a very, very important question for your exam. Okay. So you have to trace the contacts. Then you have to keep the contacts under quarantine. You have to keep the contacts under quarantine. Here, we have discussed two important top points. One is, I would say, two kind of synonyms. One is quarantine and the other is isolation. I said you have to isolate the symptomatics. You have to quarantine the contacts. Okay. Sorry. You have to isolate the symptomatics and you have to quarantine the contacts. What do you mean by isolation? Isolation is for a diseased person, right? It is a disease. Symptomatic means it's a diseased person. Let me see whether I can see. Will you be sitting for 5 more minutes? Then I can tell you 2 more points. See, we have already seen the difference between primary case and index case, right? This is a very important MCQ. Okay. Second difference you have to learn is the difference between isolation and quarantine. Okay. So isolation, okay, I'm just going to tell you what are the differences. Wait. What are the differences? Isolation is for the diseased person, right? If someone develops signs and symptoms, you are isolating them. That means you are physically separating them, right? So it is physical separation. Physical separation of a deceased person. Of a deceased person. Now, when you're physically separating a deceased person, what is your intention? The person should not give disease to another person, right? So my question is, if that is your intention, how long you have to physically separate him till he can give disease to another person, right? What do you call that period as? Period of infectivity or communicability. So there you are keeping him or her under isolation for the longest period of communicability or infectivity. Communicability. Whereas quarantine is not diseased person, but it is for a contact. Quarantine is for a contact. That means a person who might have got or who might have become exposed to a diseased person. So here the thing is, he is apparently healthy individual, right? And you suspect that he might be harboring virus in his body, right? So since you have some doubt, you are just, restricting his freedom of movement. You are restricting his freedom of movement. That means you are not allowing him to go and mix with the public because you feel that he might be having virus in his body. Okay. So if that is your intention, my question is, how long you will have to restrict his movement? You have to restrict it for the longest period of incubation, for the longest incubation period of the disease-causing organism. That means even after waiting for the longest incubation period, if the person is not developing the disease, that means he doesn't have the virus in the body, right? So you wait till the longest incubation period, and even after waiting for the longest incubation period, if the patient is free of disease, that means he doesn't have the virus in the body. So you can tell him, okay, there is no problem. You are okay. You can go and mix with the public. It's not a problem anymore. I hope it is clear. So these differences, guys, please, these differences between isolation and quarantine are very, very important. For a UG, this will be asked as differentiate between isolation and quarantine. And if you are a person who is seriously preparing for entrance exam, then here you have 1, 2, 3, 4, 5, 6 MCQs. 6 MCQs. Okay. Each of this is an MCQ. Each of this is an MCQ. Okay. Okay. All right. So I think going on to the last part. So you have to quarantine the primary contacts and you have to isolate once they become symptomatic, you have to isolate them. So these are the things that you do as part of field investigation. And coming to the last question, when do you declare the area free of Nipah outbreak? Currently, I said we are having Nipah outbreak. So we have some restrictions in travel and all. So my question is, when do you say that Kerala is free of Nipah? Or let it be any place where Nipah disease or outbreak is going on. When will you say? You means the government has to declare that, okay, now the state is free of Nipah or the outbreak is over. So when can you say it is over? Have you thought about it? When will you say it is over? It is based on some criteria. Anyone? Anyone? When will you say? You declare the area free of a disease. I'm talking about disease in common. That means wait for the, you have to wait for, I'm writing here. You have, sorry. You have to wait for, what am I writing? Double the incubation period of disease. You have to wait for double the incubation period of the disease after the last case. That means after the last case, you have to wait for the, let me add one more thing. You have to wait for double the longest incubation period of the disease. Okay. This is in general. After the last case, I repeat, after the last case, you have to wait for double the incubation period of the disease-causing agent. Then, even after waiting for double the incubation period, if no more new cases are happening, then you can say, okay, the state or this district is free of disease outbreak or the outbreak is over. So when it comes to Nipah, do you remember what was the longest incubation period in Nipah? I have shown it when we were discussing. I said 21 days. Okay, I said 21 days. So in case of Nipah, longest incubation period is 21 days, right? So double the incubation period means 42 days, right? 42 days since the last case. So after the last case, you have to wait for 42 days. And after waiting for 42 days, if no more cases are being reported from that area, then you can say, yes, the outbreak is over. Are you with me? This is also a very, very important MCQ. Double the longest incubation period. And very important, Viva question for your exam. Okay, so that finishes all the questions that I have given you. I hope it was useful. And guys, when it comes to Nipah, not only Nipah, when it comes to any viral infection, or I would say any outbreak, you have to be very, very careful. You have to wash your hands, stay safe, don't panic, stay at home, and be very careful when you're dealing with the patient. So I hope it was very, it was useful for you. And if you have any more doubts, I can give you my mobile number, my WhatsApp number. You can WhatsApp me to this number, 9895449210. And you can log into my Instagram page for details and updates in community medicine. It is DRRAJASI22. This is my Instagram page. Okay, so Hope it was useful. If you have any doubt, I'm here. You can ask me. I have tried to keep it short. I was given 40 minutes. I took 10 more extra minutes, and I'm very sorry for that. Any doubts? I'm looking at the chat. Any doubts? Most welcome, Samrat. Most welcome, Om. Okay, so I think you don't have any further doubts. Okay. So thank you very much for your patient listening. If you have any doubt, you can ask me, or I will be available in my WhatsApp number. So guys, bye, good night, take care.